And with that, Dr. Salim Surani joins us live to discuss the latest in this disease and its response. Dr. Surani, it's so good to see you. There's been some criticism that the Biden administration is not doing enough, that there are not enough vaccines. What is your take, and what do we need to do to be better protected?
Good morning, John Thomas. Glad to be here. Key thing, imagine that what would happen in any pandemic, and if we hadn't learned any lesson from COVID, was early prevention and early intervention is the key thing. It's just like when the cases are emerging, and if you are very active and you can try to prevent it, do a good testing measure, do a good contact tracing, and vaccinate the people who are vulnerable, that is something key to slowing down and stop it. Right now, we are almost more than 2 months from the first case which we saw, and it's still we have the cases keep on going up. And now the California also joined this state, which has declared emergency. San Francisco was the first one of the major city to do that. But if you look at it, even in California, their capacity to do the testing is only 1,000 per week. That is way underrepresentation of how many testing we can do that. Second thing is that the number of the vaccines, they are getting only 10 to 15% of the vaccine, which they think is essentially they need it. So I think the response, if anything they could have learned from the COVID-19 was, yes, it is not as contagious and it is not as transmissible as COVID-19. But again, it is a very, very controllable and preventable disease if we can act first, isolate the contact, do the testing, and try to vaccinate. And in some cases, even you can use the medication, antiviral medication, to help the patient who are suffering. So that is one of the key things that the government has been criticized, and I think rightly so, because we just came out of the COVID. We have the infrastructure. We just are not moving that fast.
Okay, Dr. Surani, we really do appreciate your input on this matter. It's a topic that's not going away anytime soon, and there's just a lot to break down when it comes to understanding what monkeypox is. If you have any questions about that, please send us a text at 361-855-6397.